Assalamu alaikum wa rahmatullahi, my viewers. I'm wishing everybody best of luck. I would like to continue with some other disease condition before I will further continue with the one I've discussed before. I'm going to talk about what we call musculoskeletal disorder. That is disease of the bone, the muscles, and the tendons. We all know the bones is the framework of the body, the bones that holds everything in the body. So if the bones begin to have problem, or the muscles or the tendon begin to have problem, there's going to be problem. That person will not be comfortable. That person will not be able to carry out some daily activities. That person will not be able to move very well, which can also lead to other disease conditions. So the musculoskeletal disorder, which is popularly known as MSD, is a disease of the bones, the muscles and tendon, maybe injury, tear, pains, and then swelling up that prevents someone from moving very well, prevent people from carrying out their daily activities. In fact, musculoskeletal disorder can happen at every stage of life, right from when a woman is pregnant, the baby inside can begin to experience musculoskeletal up to old age, but it's very common among old people, even among old people, among women, and there are dietary recommendations to prevent it from even happening, and it can be reversed using diet. I am dietitian Aisha Yusuf. Please don't forget to subscribe and share before we continue. So I talk about it starting from pregnancy. When the woman is pregnant, there's tendency the baby inside will develop a kind of musculoskeletal disorder, which is referred to as neurotic defect. Since it affects the spinal cord, the bones at the back, and the skull is a disease of the bone too. That's why that is also a defect. So if the mother do not eat food that has enough folate or folic acid, there's tendency the baby will come out partially paralyzed and will not be able to use the bones very well and the muscles. Such baby cannot sit very well. Such baby necks cannot be fixed very well. The baby cannot crawl or walk very well. It's a musculoskeletal disorder. Vitamin B9, which is also referred to as folate, you can get them in beans. When you cook beans, you with the fiber, you get folate in it. You can get them in chicken liver, in which I've advised pregnant women not to eat liver from beef. You can get them from millet, from dark greeny vegetables like pumpkin leaf, ugu, kuka, our popular baobab dry leaf, which is called kuka, karkashi, all this dry yakwa, moringa leaf. That is zogale. They are very high in folate. So we encourage women during pregnancy to eat this enough to meet up with their 600 micrograms of folate, or they should take their folic acid drugs given to them in hospital to prevent musculoskeletal disorder. So when the baby is then born out, there's another different intake that if the mother do not give the baby very well, it can lead to musculoskeletal disorder. At this stage, we refer it to as rickets. That's the name of the disease, whereby if the mother do not breastfeed the baby very well to acquire enough calcium and vitamin D and protein for building up the bones, the tendency the baby will develop rickets, where the disease that in a layman people call it bow leg, or you say K leg, or you see the baby's chest protructing out, or the baby having a kind of shape, long head, because the bones are not strong, they are soft, so they lose shape. You see, to prevent this, we ask mothers to make sure the baby from 0 to 6 months take up to 200 milligrams of calcium and 10 to 15 micrograms of vitamin D, and then up to 1 year, because this will help the bone to become very strong. And how would the baby get all these things? The baby will acquire this from the mother's breast milk until when after 6 months, after exclusive breastfeeding, when we start giving the baby another food, then we prepare complementary meal. That is why we add nuts, we add palm oil, we add other dry fish, crayfish into the baby's pap. we call it complementary pap or enriched pap, in order to boost the calcium and the vitamin D content. I'm going to stop here, and I'll continue with another different stage of life where we need nutrients to boost our bones to become strong until I get to old age. And I'll tell you the food that has all those nutrients to prevent it, and the way of life that one's supposed to carry out to prevent disease of the bone. Thank you very much.